have you noticed trauma affecting neurodivergent individuals differently than autistic, and how so?
Yes, any human being, autistic or not, can potentially have their nervous system overwhelmed if their capacity for resilience is here and the amount of trauma they have is here. But an autistic individual often has a narrower window of tolerance. They're more likely to be wrestling with central nervous system overwhelm, and therefore they can be more easily overwhelmed.
So why would you choose EMDR therapy over different forms of therapy?
It's much more powerful and time efficient. If a person has been in talk therapy for years, they're still activated by a trauma, they're wasting time and money, and they should really get to a good EMDR therapist and get this stuff actually resolved.
Last week, we explored how CPTSD and narcissistic trauma affect the autistic community with Dr. Kim Sage. And today, we're continuing our Autism and Trauma series with special guest and EMDR specialist Dr. Sandra Paulsen. By the end of the video, you'll have a deeper understanding of EMDR therapy and how it can support you as an autistic individual who may be healing from past trauma. You'll also have a better idea of how autistic trauma might differ from allistic or non-autistic trauma, and steps you can take to move towards a more centered and grounded version of yourself. Dr. Sandra Paulsen is a clinical and consulting psychologist who has used EMDR and ego state therapy to help many trauma survivors heal for over 30 years. She travels the world educating other professionals about the benefits of EMDR therapy and is also a published author and illustrator of therapeutic guides and workbooks, the most recent of which is titled The Beauty and Burden of Autism. I'm very grateful to be able to share this conversation with you today, as I know Dr. Paulsen's unique understanding of trauma, especially as it relates to neurodivergent individuals, will offer helpful and healing insights for the community here at Mom on the Spectrum. All right, Dr. Paulsen, thank you so much for being on the channel. It's great to have you here.
My pleasure.
Yeah, well, we'll just jump right in. For those of us who are unfamiliar with your brilliant work, could you give us an idea of your professional background and how you got into this line of work, maybe particularly the EMDR therapy focus that you have?
Sure. So I'm a clinical psychologist, have been for, 35 years or something ridiculous, very long time. You can call me Sandra, by the way. And I had been just fresh out of my PhD program, and someone demonstrated to me the effects of eye movements on internal experience. And I set about reading about EMDR, and then quickly found myself needing to get trained beyond the little bit that was available in writing. And that was in 91 and 92.
So you said someone demonstrated the effects to you. Can I ask more about that? How did they express the connection here between eye movements?
Well, and I wouldn't recommend this, but at the time, my colleague was celebrating that she had been in the very first class about EMDR training. And so we were in the same doctoral program. And I said, "What do you mean eye movements?" And she demonstrated for me, had me follow this movement with her eyes. And I could feel something happening in my brain. So I knew there was something to it. Turns out there's much, much, much more to EMDR than eye movements. Had I been somebody with a complex trauma history, that could have been a serious error to sort of start somebody's processing without having the whole protocol around it
Okay.
for its safe resolution.
So can
So,
I press on this a little bit more? You said you felt like you had like something was happening in your brain. Can you say more about that?
well, I just felt a little movement, and
Okay.
I'm a discerning person. My proprioception, kinesthetic perception's quite acute.
Hmm.
That's one of my sensory sensitivities, is that I don't miss much internally. So I felt something happening, and it just was enough to whet my curiosity. I don't think that's particularly common for people
Hmm.
to notice.
But you noticed a shift there, and that intrigued you to explore more. And we'll
Yeah.
get into the nitty-gritty of what EMDR is. First, I want to ask, what is your specific connection to the neurodivergent community?
Well, I'm on the autism spectrum myself, extremely late diagnosed, 69 years old. Although I'd suspected it when I was 9. Perhaps we'll save the details of that discussion for another
So
day.
suspected it when you're 9, and you said diagnosed 69?
Yeah.
Wow. Okay, so you carried it for a while.
Well, I thought I read something about autism when I was little, and I thought maybe that's me, but I was told no, it's not. And because at the time, the idea of a level 1 autism with minimal support needs was not on the radar screen at all, and
Mhm.
certainly not in women. So,
I'm curious, so you had that kind of idea when you were younger that you might be on the spectrum. Did that idea keep coming back up for you as you developed a profession in psychology, or did
well,
that kind of it just kind of went on the back burner?
because I mean, you have to understand, I'm a billion years old. So in the 50s, this was in the 1950s, and there was, I mean, autism was barely even discussed, and it was considered a very severe disorder. And indeed, level 3 autistics with profound support needs often have no language, sometimes very limited control of their motor function. And I mean, there's a lot of variability, of course, but I was not that. I was academically gifted. And so obviously I'm not that.
Mhm.
So it's only in the recent years that I revisited, starting probably 15 years ago.
Okay, so this is all I love the intersection of all of this because you've explored EMDR from so many perspectives, and I want to get into how it's kind of shifted since you have understood that you're autistic, but let's kind of go back and let's talk a little bit about EMDR. So can you tell us what does this stand for?
Mhm.
What is this therapy? How does it actually I've heard of it. I've read about it. I'm so intrigued by it, but like you said, eye movement, something happening in your brain. What is it? What does it stand for? How does it work?
Okay, EMDR stands for eye movement, desensitization, and reprocessing. And it turns out it doesn't have to be just eye movements, although I believe eye movements are the most potent because they're wired to the the brain's REM sleep processing function. The other two modalities are tactile, like a buzz, 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 buzz. You can hold buzzers and have bilateral alternating stim that way, or auditory, which is probably the least powerful of the three. So the idea originally, when Francine Shapiro discovered it in 1986 or 7, serendipitously while she was walking in the park, she had gotten, I think, a tough medical diagnosis, and she was upset. She was walking in the park, and she discovered, and she's gone now, but she was absolutely brilliant at IQ off the chart, and she noticed that that which had been so disturbing was no longer disturbing, and she asked herself, "What had I been doing?" and realized her eyes had been darting back and forth while walking. And I knew the woman, and her eyes spontaneously did go back and forth. But she went back and experimented with it, and she found that she could get this result where trauma could be less disturbing after this process. Initially, she thought it was mostly just the eye movements. But turns out, when she started doing trainings, she realized that there's much more that's needed in order to have a protocol that ensures safe and effective outcomes, because there's a wide range of conditions that people bring to the table and capacities that people bring to the table and trauma histories. And so all that has to be assessed and taken into account. My particular interest now, over pushing 35 years, is I've been very interested in the most complex cases, and I've written books and protocols that modify the basic EMDR protocol in order to accommodate various complex conditions, including DID, which is the most severe of the dissociative disorders, somatic dissociation, where someone's disconnected from their body, and there's a couple different ways to get there. One is through neglect in the first years of life, but another way is through autism, because some autistic individuals are alexithymic and disconnected with their
Mm-hmm.
body. Attachment injury is the third category of complex case that I've been very interested in over many years. And then in the last few years, autism, which is complex in its own way.
So you're starting to develop. Has anybody else done this, kind of connecting EMDR specifically to how it can support autistic individuals?
Oh, yes, there's the queen of EMDR and autism is Sherry Paulsen, no relation. It's
Okay.
spelled SON. And she and I are colleagues and buddies. And in fact, she wrote, I think, the foreword to my book on autism. But
Okay.
she was the first to contribute in this way. And around the world, there are various people. I'm probably a slightly late comer to the field of autism and EMDR.
Well, we're glad you're here and we need you. So please keep working on it. No, that's wonderful. So, okay, EMDR specifically, well, I know there's a lot of variation in EMDR because there's probably a lot of adapting it to each client and their background and their history. But I come into your office for an EMDR session. What does it look like? Is there a piece of paper with different patterns that I follow with my eyes? Like how does this work?
Well, in my office, I have equipment that I've had for decades. It's a light bar, and it also has attachments for tactile and auditory stimulation. And so if I use my remote control from my swivel chair here and I turn on the light bar, which is over there in front of the client's love seat, it causes the light to go back and forth. And there's no magic in the light. It's just a way for, if they follow the light, their eyes are moving. If they've got the buzzers in, they're getting bilateral alternating tactile stimulation. Now, some of the recent developments in EMDR land is that you may be able to get the same effect by simply taxing working memory, because the light bar, the light moving, the sound, all those things are alleged to not only catalyze the brain's information processing system, but tax working memory so that you can't simultaneously, for example, count backwards while being aware of a traumatic event. And if you're focusing on counting backwards and then you go back and check on the traumatic event, it's less disturbing.
Well, that's bringing up for me. Have you seen, I guess this might be part of your work actually. So I've seen, on social media, the bilateral, what do they call it? Like the beats, like the audio tracks where they go.
Binaural beats, right?
Yes. So
Binaural
can that be
beats.
incorporated in EMDR therapy?
Well, there for decades, in fact, it was David Grand in New York decades ago that first brought binaural beats and combined with music while people are processing. I've never adopted that because I want whatever needs to come up without being interfered with by a particular music track. Eye movements are the hardest. They're the most hardwired, is what I was trying to say. Because if your eyes are moving, your brain is processing. So the therapist can see, oh, their eyes are moving or their eyes are fixated. Whereas
Mhm.
with the auditory and tactile, it's passive. The client's receiving the stimulation, but they could be feathering the brakes or dissociating, which is both a weakness of those modalities and a strength, because some people want to feather the brakes
Okay.
so that they're not overwhelmed.
So going back to the eyes following the light and the therapist is watching this happen, are you guiding, I don't know if you refer to them as clients or patients, are you guiding them with questions? What's happening while they're following the light with their eyes?
So there's an initial, past the initial history, because one has to take a very careful history to make sure that the person's suitable and ready to do EMDR, that they're not going to be metaphorically thrown down a flight of stairs by the EMDR, because it can be quite surgical. And so there has to be a readiness.
Okay.
But after that initial intake and assessment and diagnostic process, and I use the word client and patient interchangeably, I usually say client, then there's, on the day that one's going to do the EMDR, there's a target workup, or it might have been done the prior week, where you select what issue is being worked on. Like, is it the fiery car crash, or is it the long-standing distant relationship with a family member? So it can be something that anybody would call a trauma, or it
Mhm.
could be a life experience that had a maladaptive outcome or maladaptive lesson learned that people might not call a trauma. EMDR also works for anything that's unresolved, a relationship breakup, or a dropping out of college, or a failed friendship. They may not qualify as a big T trauma, or they may, but if the person resolved to never again take a risk or something, you can say it had a maladaptive outcome. Often, when that happens, we find that there's also early childhood foundational experiences too, that the person had early rejection experiences or early disappointments that accumulated over time, like Russian dolls, one inside the next. With every year that goes by, there's more lessons learned and more recommittals to what may have originally been what I like to call the tiny executive in front of the refrigerator that says, never again will I ask for what I need because of the graham cracker incident, you know?
Okay.
You can't call it a big T trauma, but a million little T traumas and you got trauma.
Would the outcome then of would the desired outcome of an EMDR session then be to think back on those past traumas, whether they're big T or little T traumas, and are they have less of an effect on you? They have less of that traumatic residue. What would a successful EMDR session result in?
So you pick the issue, you pick a prototypic event if the problem is in what we call explicit memory. That is, there's picture, there's narrative about the event. One does the target workup for that event on the assumption that there's other related memories in that neural network or file folder in the brain. And one articulates a picture that represents the most disturbing aspect of the event, the negative cognitions, negative self-statements associated with that event, like I'm worthless, I'll never be loved, I'm a loser, those kinds of negative self-statements. So what one would rather be saying instead, how true that positive cognition feels in the gut, not the head, but the gut. And then we go into, it's like making the incision metaphorically. There's no scalpel involved, but we light up the net by the therapist repeats the picture, the negative self-statement, and asks the client what they're noticing in their body, what emotions are there, and how strong that is on a 0 to 10 scale. And then at that point, the person is typically accessing the disturbance, and then we add the bilateral stim in sets. So there's silence while the eyes are moving, and then in between the therapist says, and what are you aware of? Or some other open-ended question, and the person reports, I'm remembering the screech of the brakes right before the impact of the tractor trailer rig. Ideally, there'd be 90 minutes to complete the processing of an event like a car crash. And by the end, one expects that the disturbance will be 0 or 1.
Okay.
And the desired positive cognition is going to be on a 7-point scale, where 7's completely true. It'll be either 6 or 7. And if it's not, then there's more work to do on that, or it's been worked up incorrectly, possibly.
So why would you choose EMDR therapy over different forms of therapy?
It's much more powerful and time efficient. It goes much faster. It goes much deeper. So I've had people who have been talking about their child abuse from their childhood, or their fiery car crash or their rape. They've been talking about it for years in talk therapy. But EMDR goes deeper than just upstairs. It goes deep into the felt sense. So the emotions and the body sensations also get processed. And as I said, there's a very complex protocol to make sure it's actually completely processed.
And I know that there's many in our community who are in that stage of feeling like they've gone from therapist to therapist to therapist, and they're just rehashing things, and they're tired of going through their childhood trauma, and how many different ways can I approach this? So it sounds like EMDR, like you said, it's a shortcut through some of that. So for those of us in the community that are listening to this and thinking, I'm so tired of dealing with the same issues, but I haven't found any progress or any healing, it sounds like EMDR is a great thing to pursue in terms of finding relief and some healing.
Absolutely. If a person has been in talk therapy for years or certain other kinds of therapies, and they're still activated by a trauma, they're wasting time and money, and they should really get to a good EMDR therapist and get the stuff actually resolved. It's more complex than that, because if somebody has one of those really monstrous childhoods, then simply doing EMDR, it can actually make things worse if it punctures dissociative barriers that have been protecting people from the extreme agony or even awareness of what happened. So for those complex cases, there has to be whole other procedures, and we don't have to go into all that right now. I just wanted to make it clear that people with complex trauma histories need to work with an EMDR therapist that's not just using the standard protocol, but knows its modifications for complex cases, whether it's DID or alexithymic, somatic dissociation, etc., or attachment injuries. Because with attachment injuries, those happen in the first 3 years of life. It's a pre-verbal time period, and there's no picture memory. There may be no narrative at all. So that's another whole complexity.
So an attachment injury would be a caregiver, something happening that detaches you from a caregiver at a young age?
Or the caregiver is, let's say, alcoholic, or for whatever reason, unavailable to the child.
Okay.
Or if there's violence in the home, or there's many examples I could give of the kinds of things that disturb those early years of life.
Mm-hmm. So you're talking about having different approaches, making sure that if you do seek out EMDR therapy, that the therapist is familiar with how to approach it in different ways. Have you noticed trauma affecting neurodivergent individuals differently than autistic, and how so?
Yes, it's a wonderful question. Any human being, autistic or not, can potentially have their nervous system overwhelmed if their capacity for resilience is here and the amount of trauma they have is here. The most resilient person in the world, if they have this much trauma, whoops,
Off the screen.
is going to be overwhelmed. But an autistic individual often has a narrower window of tolerance. They're more likely to be wrestling with central nervous system overwhelm on a daily basis, and therefore they can be more easily overwhelmed. The risk that can come to anyone of having their trauma processing in EMDR exceed their capacity is heightened with autistic individuals because the window of tolerance may be narrower. As I mentioned earlier, some autistic individuals are alexithymic. That is, they have a hard time finding words for emotions, or even, and the word is used as well to mean that the person's unaware of emotions or what's happening in their body, because emotions have bodily correlates. If the person is alexithymic to the degree that they operate largely in their head, like many autistic individuals do, and not with awareness of emotions and body sensations, that EMDR is going to go badly. It may not go anywhere at all, or it might be that they hit the wall at 120 miles an hour that they didn't see coming, because they're indeed processing is just happening out of awareness. So it can, with delayed processing, which many autistic individuals have, it can catch up with them hours or days later. And then they're going, what the heck's going on? So the therapist and the clients need to be alert to delayed processing. But there's things that need to be done before the autistic person experiences EMDR to make sure they can connect with emotions and body sensations. And I'll briefly mention two things.
Okay.
One is somatic therapy, which is a kind of therapy that it's kind of like EMDR in slow motion. They just have people drop into the body and become discerning of what's happening in the body. Time slows down. The therapist guides the client to become aware of emotions and body sensations in a moment-to-moment mindfulness kind of a way. And if the person learns to be discerning of emotions and body sensations through somatic therapy, then they'll be ready for EMDR. They'll be able to do the task of noticing and reporting what's happening in their body, as well as cognitions. The second thing that helps autistic people, not everyone, but many autistic people, to become prepared for EMDR is to go on a drug called low-dose naltrexone. Many people only know about it, if they know about it at all, at much higher doses for alcoholics and drug addicts, because it's an opioid antagonist, which means it blocks the effects of alcohol and drugs, and it even blocks the urges for alcohol and drugs. So there's a whole literature and use of naltrexone at much higher doses for alcohol and drugs. That's not what we're talking about. Low-dose naltrexone is usually right around 4.5 milligrams, although it's by body weight. And it's still an opioid antagonist, but this is really interesting. The phenomenon of being somatically cut off often is learned for people who had neglectful childhoods. If the child's overwhelmed because no help is coming, and they're either discouraged from having emotions or it's too painful to have emotions because no help is coming, then the child learns to cut off. It's like clipping the dashboard wire so they don't feel. And that often makes selfish caregivers happier than more loving caregiver who would help the child with her emotions. What happens then is the mechanism by which children learn to cut off their emotions and body sensations is through the body's own opioids. So if you were a gazelle out in the African savannah and you'd been trying to outrun the lion and you were about to collapse in exhaustion and be had for lunch in the last moments before you died, you'd be washed with the body's own opioids, which are painkillers, so that it would be less painful. And that's the same mechanism, we think, that children use to survive any kind of child abuse, including emotional neglect. So back to naltrexone. Low-dose naltrexone reconnects those clipped dashboard wires, if you will, metaphorically, so that the person can begin to discern emotions and body sensations. And the same effect happens for some autistic individuals. If I'm going to be working with somebody and I know they have trouble accessing emotions, I get them on low-dose naltrexone, because then when they come to me for EMDR, they'll be able to connect and feel it. And that I find that to be true also with autistic individuals, but not every autistic individual.
I'm fascinated by this. So I'm guessing this is a short term of being on the medication.
Well, yes and no. I mean, I only work in the intensive format. So people that I've never met before, except to do an intake by Zoom, fly in for 3 full days and fly home. And we get a lot done in 3 days. A few people choose to come back because they have more than can fit into 3 days. That's not the typical therapist, although there is a trend towards intensive work now.
So do they, outside of the time that they have with you, let's say that they're on this drug, do they notice that in everyday life they're feeling more connected to their emotions and experiences?
Well, interestingly, when people first go on it, they notice nothing. They expect to notice something, but there's nothing, and they notice nothing, and they don't notice anything until they're in a therapist's office and the therapist says, "What are you noticing in their body?" And then for the first time, they have an answer.
So it kind of takes that guidance of, so you kind of do the
Yeah,
groundwork with the drug, and then
right.
the therapist helps make you aware of that headspace and that ability to headspace is the wrong word for it, but it helps open you to that experience of registering what's going on in your
That's right.
body.
Discernment. It helps the person learn to discern what's happening in their body, and so it's like I'm acting as a biofeedback loop often because I can feel it in my body what's happening over there. That's mirror neurons. That's a separate whole interesting subject. But
Yeah, this is just opening
back
up
to
and
your
up and up.
question. What?
I said it keeps opening up
I
and
know,
up.
I
Next
know.
time, go ahead, go back to
That's
the.
why I can't retire. I'm 72. I can't retire. It's just endlessly interesting. But in terms of your question of whether it's short or long term, if you think about if you had been driving your car for years, never having had the dashboard, that little light that's a dimmer switch, and so
Mhm.
you've never been able to see the dashboard gauges, so you could never read them. If somebody came and said, here, and they turned up your dimmer switch so you could finally discern and see the
Mhm.
gauges, because emotions and body sensations are like dashboard gauges. They each provide a different kind of information. At first, you just see this dizzying glow of all these different gauges, and it might take you a while to learn how to read them.
Because
And
it's
that's
so
what
much information. It's
yes,
always been there, but you're just now aware of it.
that's right, all at the same time. And so it takes people between a few months up to about a year, maybe, depending how observant they are and motivated they are, to really learn how to read their emotional and bodily dashboard gauges on the low dose naltrexone. And then they can stop. Low dose naltrexone is used for other autoimmune conditions. And
Okay.
since so many autistic people have autoimmune issues,
Hmm.
they might choose to stay on it for those other reasons. But that's more medical. It's sort of over my pay grade.
And maybe we shouldn't go here because we'll just keep going up. But I am curious about that connection there. I mean, what can you say a little bit more about that connection between autistic people and autoimmune disease? Because that's something that I've noticed as well.
Well, there are some who believe that autism is itself an autoimmune condition. I am not prepared to make that claim or prove anything. I just know that every autistic person that I know seems to have something, whether it's Sjogren's or
Hashimoto's,
Hashimoto's,
Crohn's.
gluten sensitivities, and
Hmm.
other digestive issues. I mean, it goes on and on and on.
Yeah, I'm just
So,
curious. I've noticed that a lot too, and for myself, I mean, I have alopecia, and I've dealt with that since I was a child, and then so many people that I talk to have those digestive issues that tend to be kind of autoimmune
mhm,
related. So it's
mhm.
very interesting the correlation there. But so what you're talking about with this kind of awareness of our bodies and emotions and all of that, this would be akin to kind of mindfulness practices that open you up kind of to awareness of things you haven't been aware of before.
Yes, um, yes, mindfulness practice can also get you there, but it's much more arduous.
Mhm.
The low dose naltrexone, I mean, it takes a couple months to be titrated up. They usually start at like 1.5 milligrams, and it has to be compounded at a compounding pharmacy. Then they increase it typically by about half a milligram a week until they get either to 4.5 or the person discerns a sweet spot. Because there are some people that do notice, whoa, I went on it to see what it was like. And I noticed a definite sweet spot where I like everything looked brighter and just beautiful. But
That's
I've never
fascinating.
heard anybody say that besides me.
So you're mentioning this process kind of happens when we're younger. We have this rush of opioids to kind of protect us from some of the harm that we may have faced as a child. Does is there a limit to that? Like, does that supply of opioids run out as a child?
Well, it's very interesting. You see that effect more with people that have really the monster sized trauma where, they're molested hundreds of times and beaten hundreds of times and, human trafficked and, oh God, the worst of the worst. Those people tend to be more at risk. From my experience, I've never read any science on point, but for adrenal fatigue or those kinds of conditions that come from chronic stress.
Maybe like chronic hypervigilance as well, just being on alert all the time.
Certainly that, but it's got biochemical correlates that I'm ill prepared to talk about. With people who are alexithymic, I don't particularly see that, whether they're autistic or not on the spectrum. I don't see that level unless they also have a big T trauma history. And we never finished talking about things that are different doing EMDR with autistic folks because we're going down
We got
this
distracted.
rabbit hole. We're both at risk for rabbit holes. They're endless. Autistic individuals often will have trauma histories that include bullying, social rejection, and all the confusion that goes with that. Some people come from families that are critical or disappointed because they don't understand that it's not a volitional thing, or they might not even have a diagnosis for the child. And some families are quite supportive. I was lucky. I came from a family, I think it was chock full of autistics. That was overstated a little bit, but none of us diagnosed. And so it was understood that we were quirky, and we just set about doing that, just being quirky in our own way. But many people don't have that. They come from families that say, why can't you be different? What's wrong with you? And so forth. And another category of trauma that can happen to many autistic individuals, because so many autistic people are naive or gullible, or
Mhm.
so therefore they're at risk for exploitation.
Mhm.
And so it could be sexual exploitation, or it could be professional exploitation. I mean, Seattle's full of software engineers that are being exploited and working 100-hour weeks because they can focus and they're willing to do it, even though it's to their, it burns them out.
Yeah.
And there's other categories of exploitation as well, financial and so forth and so on. So those are some categories that any therapist working with an autistic client should be thinking in terms of checking to see if those categories are manifest as trauma categories for that person. But additionally, there's nothing about being on the spectrum that protects one against fiery car crashes or any of the other sources of, combat exposure, although maybe one wouldn't get into the military if they had a diagnosis of autism early, but they might. And I certainly have worked with people that were in the military that had never been diagnosed, and they had several tours of combat duty, and it's pretty serious for an autistic nervous system to be trying to manage all of that.
Are there any resources for professionals out there who want to better understand the autistic approach or the approach to helping autistic people in EMDR? Are there any set of guidelines or principles that can be shared?
I wrote this book for that purpose. It's The Beauty and Burden of Autism, written for both therapists and clients. In fact, it's in large font to help with conversations in the therapy office or at home over a coffee table where a person can discuss it because the font is big, and it's full of 100 of my original cartoons.
Yes, Sandra's a cartoonist as well, and that's part of what I love about this book is there's so many fun illustrations in here to help you understand concepts. But you can use specific stuff in here can professionals adapt some of the things in here for help with EMDR therapy for autistic individuals?
Yes, there's the right side of the book is cartoons and discussion points, and the left side are worksheets so the client can it's intended to help the client think through their reactions to the cartoon on the other side or whatever is being discussed. But it could also be used by the therapist for guiding those discussions. There's also, for any therapist listening who's EMDR trained, I've got over 25 online on-demand videos through the Steve Frankel group, sfrankelgroup.com, and several of them are about autism and EMDR.
I'll put all of these resources in the description so anyone watching and listening can access them, because I think it's so important. And that's kind of what I'm feeling right now is maybe for autistic people watching that, oh, this sounds great. This sounds wonderful. Like I want to get that healing. I want to have that shortcut because I've been through so much talk therapy. But it sounds kind of daunting to find a professional that has this level of care in the approach that they take with autistic individuals. Is there any sort of network, any resources that you can share to help us find more qualified providers?
Yes, and this is a pet peeve of mine, is that lots and lots and lots of therapists take the training and never use the EMDR, and then they list EMDR on their website. So those of us who are gullible or naive need to be jaundiced in this regard. How much do they actually use EMDR? Because if they're just getting their feet wet or they use it, but they mostly use other things, I wouldn't even go there. The best way to get somebody who's at least jumped through the hoops properly, they can go to emdria.org. That's emdria.org. That's the International Association. People's credentials will appear there. Are they EMDR trained and certified? Are they a consultant? Because a consultant is a higher standard. Are they an instructor? That's an even higher standard. There's another angle. Originally, EMDR was only taught by the EMDR Institute under the direction of Francine Shapiro, who originated it. Now there are many people teaching it all around the world. The EMDR Institute is how I was trained, and you can go to emdr.com, and anybody who's been a facilitator or a trainer for emdr.com would be well trained as well.
Yeah, that's really helpful. And again, I'll make sure that I put all of these resources in the description for everyone listening and watching so that you can find the right resources. Because I know so many of us feel like we've wasted our time going in circles with different providers who just aren't able to take that level of care and compassion that the autistic community really deserves and really needs. So Just so appreciate the work that you're doing to communicate the differences and how therapy needs to be tailored for our community. One thing that I'd like to go back on, just because I feel like this is such an important point, and maybe we can kind of wrap up here, but back to the opioids and connecting back to those feelings that maybe we suppressed when we were younger out of protection. There's a couple of things I want to say here, but I've had this idea before that sometimes that alexithymic experience, can that be a coping mechanism? Can that be something that is turned on at an early age to dissociate or to not feel things? And can it be turned back on?
Oh, I think that for many people, whether autistic or not, it's exactly that. And it can be turned back on. But I don't want to give the impression that every autistic person who's alexithymic in any sense chose it, because
Right.
there's reason to think it could be hardwired as well.
Mm-hmm.
And that's what's so interesting is, can it be, if it's hardwired, if it's part of autism for some people, not all, can it be learned anyway? And I'm pretty optimistic. I think it can be, we can become more discerning.
That's where I'm at too, and what I've seen within our community. And I so appreciate the angles you take, just in notating that all of our experiences are different and we can all have different alexithymic experiences. But I have personally found in my life, yes, some of the alexithymia is more dissociative and is more of a coping strategy that has protected me in the past. But now I'm opening myself up to more of these experiences of, well, what is my body feeling? And creating safe spaces where I can be open to processing that information of, oh, yeah, I'm really mad right now. So I just want to share that with our community, that if you feel disconnected, I think you mentioned it earlier, Sandra, like kind of trapped in our head. This is something that people in the community have shared too, that they feel like a floating head sometimes, just completely disconnected from the shoulders down. If you feel like that within our community, I do feel like there's a lot of hope, through EMDR therapy, but also through different modes of creating awareness and just connection to our bodies, that we can have a fuller experience emotionally, which is scary. Like, honestly, I feel like it's scary for many of us who haven't felt those emotions before, but I think it also leads to a depth of life, like a depth of experience and connection to our bodies and to the world around us. So I really appreciate that approach of just sharing that hope that we can connect to deeper parts of ourselves and find healing through that.
Absolutely. And if I may, I'd like to add one other sort of
Of course.
cautionary thing, which is that it's another pet peeve of mine. I have, because I'm a senior EMDR practitioner, other EMDR therapists sometimes refer me complex cases. I've seen autism missed so many times, and instead they're called narcissists or otherwise personality disorder or other misdiagnoses. But what I want to say to any autistic people who might be listening, anybody on the spectrum, if you've had the feeling of you're not being understood, and you're being misunderstood, and you're not getting the help you need in with your therapist, I would trust that. And it might be that you're with somebody that doesn't know enough about whether it's trauma or EMDR or autism or all the things you got going. And so they're having to construe you through a set of blinders that they've
Mhm.
got on. Don't give up. Don't get discouraged. Being on the spectrum has many challenges, and it's different for everybody. So if you hold out for somebody who can understand and is willing to work with your system, you can get great support.
Yeah, and I appreciate that as well, because I think it goes back to that sense of trusting our intuition. I've noticed that so many autistic people, again, a generalization, but we tend to trust the process, trust the routine. Okay, I signed up for therapy. I'm going to follow through with therapy. It's a certified professional. I'm going to trust their insight. I'm going to keep going with the process, even though it's been years, whatever. Trust your intuition. If you're not getting what you need to get out of those sessions, generally speaking, I think autistic people, we follow the rules, we follow the instructions. And if you've done it for a while and it's not making a difference in your life, it is okay to try a different professional, to try a different approach. And that's not that you haven't done it correctly or seen it through as much, I think sometimes we think we need to suffer a little bit more through the process to get the results, but there really is hope sometimes in just switching it up. Like, trust your intuition. If you're not getting what you need, try something else. You don't have to. I guess the other thing I want to say is, just because someone is a certified professional doesn't mean that they're the authority on your experience. And so if they say something that doesn't line up with your experience, you don't have to try to make that fit for your life, even if they're credentialed. It's not that you don't respect what they're saying, it's just it might not line up with your own experience.
And the client will still be autistic at the end of even the best therapy, but the trauma can be resolved. They can have much better self-care and self-acceptance and so forth.
Oh, I think that's such a wonderful way to wrap up. So, yeah, I will make sure. I've talked about this book on the channel before. I absolutely love it. Again, a generalization, but many of us out there, I know who you are. I know how we are. We love workbooks, and this is a fun, colorful, illustrated workbook. She also has it available in black and white. So there's different options available there. I love the workbook so much, and then I will put a link to Dr. Paulson's work and other resources in the description. Thank you so much for joining us, and I hope to keep these conversations going with you. I learned so much.
Thank you so much for having me. I love being here.